This week, we learned more about the death of a mom from the Salida area. The autopsy of Suzanne Morphew, released yesterday, says her death is homicide. The report found 3 drugs in her bones, some sedatives and a tranquilizer.
So for more context on these drugs, we're going to talk with our 9 health expert, Dr. Powell Coley. So we talk about sedatives, and those might be found in many people. Tranquilizers are not for people.
Yes, in fact, 2 of the 3 drugs that were found in her body are not used in humans. They're for animal use only. One of them does have a human indication for pain relief. It's an opioid, the butorphanol that she had in her system. It's used for migraines and such. But the azaparone and the medetomidine are animal products. And so that second medicine is actually used as an antipsychotic for pigs, mostly as a sedative, to subdue them if they're being agitated or they need a prolonged procedure. And that third medicine is actually an anesthetic medicine that's used before anesthesia or surgery on animals.
Tell us about this science, though, like finding a body 3 years later and still being able to find these traces of these tranquilizers in her system. It's amazing science.
It is amazing. And so what it tells us is that the concentration was probably a bit high, right? Because how much we find dissolved into the tissues depends on the concentration of the drugs administered. It also depends on how much tissue you have and whether those drugs dissolve in water, in fat, or in muscle. And so different drugs have different properties as to how they dissolve. Suzanne was apparently healthy, so she probably had normal kidney function, normal liver function, so how they're metabolized was probably normal. But it's plausible that these could have been in high concentrations in a small woman, and that's one of the reasons we're still finding it in her tissues many years later.
That was the thing I was going to ask, like in her bones, though. Is that common? I mean, we hear about toxicology reports sometimes, and when you hear about autopsy reports, that's such a huge factor in the criminal process itself. But what does it mean when it's in your bones?
Well, it's very different for a human who's alive with the circulation, right, where the blood is being circulated to the organs that expel it, like the kidneys and the liver, as opposed to someone who dies. So when you administer a medication to somebody and their circulation stops when they die, it basically sticks in the tissues because it's no longer kind of moving.
Oh, I get it.
Yeah.
So these tranquilizers, obviously, there's no common usage that you've described for people. So this really does point towards, I mean, I know you're not a forensic pathologist, but that's what points you towards foul play.
Well, to me, this was really alarming because 2 of the 3 don't have human use. They're highly regulated, so how someone would even get a hold of them to administer them, and they're used as injections, so you have to give them intramuscular or intravenous. These are not readily available from a pharmacy or even on the streets. These are very highly regulated compounds, and when used in combination with each other, you know, one being an opioid, one being an antipsychotic, and one being a tranquilizer or sedative, you're talking about synergistic effects on suppressing respiration, your breathing, suppressing your circulation, your heart, even causing conditions like hypothermia or low temperature.
So that could be the cause of death.
Certainly. In and of themselves, these drugs can induce a general anesthesia state, and if somebody's not supported during general anesthesia, that in and of itself could have been a cause of death without necessarily something else happening after.
You're also not a veterinarian. Are these used to sedate animals for surgery, or would that be their actual use?
Yes, yes. So one of them is a analgesic. It's for pain relief and for sedation during surgery. One is an antipsychotic if the animal is being very agitated, if they need a procedure and you need to calm them down, or if they're getting delirious.
Do you know it's cows, dogs? Do you know who?
Pigs, large animals, horses, pigs. You're talking about zoo animals. You're not talking about small human beings. In fact, we don't even necessarily know what the effects of these are on humans because we haven't studied them. So the fact that we found it in her body, to me, is highly unusual. Even that story that we heard from the lawyer that it might be readily accessible because that was a wildlife hunting area is a little bit suspicious to me because, again, these are regulated drugs that are imported, that you need a special permit. You need to say why you're importing them, which animals you're using them in order to get them here into the U.S.
Well, it's just proof of how important an autopsy is, and a doctor doing these kinds of tests. Otherwise, sometimes and there was a lot of relief when her body was found because people wondered what happened. But this opens the door to a few more questions.
It does, and it can hopefully help us to know not just how she died, but also maybe some of the other circumstances leading up to her death.
Okay, thank you, Dr.